It is often said that youth are our future, but I am also a believer that they are our right now. With more information at their fingertips than generations before, and an optimistic outlook on their ability to influence change, partnering with the youth in our community is critical to Frederick's story. In collaboration with our Youth Advisory Council, we are talking about issues they have identified, issues they care about most deeply. Please join the conversation and listen. It takes our entire community to move forward and grow.
Hi, my name is Sam Boison. I'm a senior at Frederick High School and also the chair of Frederick's Youth Advisory Council. Today, I'm here with Mayor O'Connor to discuss human services for the second episode of Civics with the Mayor. Hello, Mr. Mayor.
Sam, how are you?
I'm doing well, and you?
Pleasure to be here, thank you.
Awesome. So today's first question is, as Frederick's mayor, how would you describe the city's role in ensuring comprehensive citizen services?
So it's a great question because it really gets to the core of what local government is all about. We're at our core in the service delivery, whether that's the police protection or providing great parks, the human services side of it, the citizen services, particularly those services to those in our community who are most in need, becomes a really critical area for us. We do that with a lot of support from federal and state and some county resources, but we're the ones that know our community best, and so it's really an opportunity for us to tailor programs and services that are really geared towards the needs of our community. And those needs, depending on the state of the economy or coming in and out of a pandemic, allows us flexibility to be to move quickly to try and address those needs as they emerge.
Government should be doing that, but I think also just sort of providing the basic things that everyone needs to live, I think, is a good start. And if they can't provide that for themselves, sort of having being that crutch for the people that can't provide that for themselves.
It's more so about the people and sort of giving to those people, especially those people who are less fortunate, almost guaranteeing that they have enough resources, enough funds to be able to live off on their own or to be able to make sustainable income or sustainable standard of living.
As you know, a major goal of citizen services is to get citizens to reach a point of self-sufficiency. And I would like to know how the city determines self-sufficiency, and how does the city determine whether someone needs aid and how much they need?
So it's a really challenging problem that we have to solve, because people have different needs at different levels, and those needs exist across a lot of different services. So it could be at its basics housing, or food insecurity, or other kinds of social services, rent or utility support, or healthcare, which we do through our federally qualified health center. A lot of the programs that are specific to what someone needs are driven by formulas that the city doesn't determine. Poverty levels that are defined in federal law, and poverty levels that are 100% or 50% or 200% of what those federal numbers are. The programs are very specific in terms of the money that comes in and how they get allocated, so there's a lot of management and compliance on our side to make sure that we're doing what the grant funding that we've received has done. When it's our own funding, we have more flexibility. And so to be full service, we're really trying to provide an opportunity across a lot of different service areas, but the city can't do it alone. And so our partners in this effort become really important. The other social service agencies that are non-governmental, that are working in these areas, whether it's housing or clothing or food or other kinds of financial assistance, we want to build strong partnerships because the city can't do all of that. But through our Department of Housing and Human Services, we are fairly broad in scope of what we are able to support and provide on behalf of residents. Determining what self-sufficiency is a much harder thing to answer, because that's a very individual. I think what we want to try and focus on is giving people what they need in order to help them to achieve the best life that they can for themselves.
Certain places like the Child Advocacy Center, Scott Key Center, and different departments like Housing and Community Development, in which kind of direct people in the right direction despite being in a low place, whether it's financially, socially, or even their health.
I mean, I'm aware of the Frederick Community Action Agency, and they do a lot. They cover a lot of bases, from running the food bank to helping with incomes and paying bills for Frederick citizens.
Growing up in Frederick, I've grown to know lots of agencies in the area, such as the Food Bank, the Housing Authority, the Frederick Community Action Agency, and more. Could you tell me about the necessary and proactive collaborations these agencies and organizations may have, among others, in order to improve the lives of Frederick citizens?
Yeah, they have to talk to each other, because very often someone who has a need in one area might very well have needs in other areas as well. And the more these agencies are communicating with one another, then we can be sure that the services that an individual receives are complete wraparound services, that they're getting everything, that we're not looking at just perhaps a symptom of a problem, but we're really trying to identify to the greatest extent possible what the underlying causes might be. And very often that starts with housing, so that if you can get someone in a situation where they no longer have to worry about where they're putting their head down at night, that may allow them to better focus on some of the other needs that they could have in their life and address them. But the agencies that you mentioned, some are private, some are governmental, some are quasi-governmental. The coordination and collaboration is really critical to make sure that people aren't falling through the cracks. It isn't a perfect system. It is not satisfying everyone's needs all the time today. We have to constantly evaluate the services that we're providing, and we have to have enough courage to look at a program that isn't working and recognize that and adjust it and modify it so that it does work. So I'm an advocate for that constant evaluation and adjustment to make sure that we're delivering the services that people need in the way that people need them today.
I think jobs are really important, and not just jobs, but sustainable ones, that not only help the people around the community, but also help the environment, or help a better future, a better world for all of us.
I know that there was a big grant that the Frederick Community Action Agency received to sort of help with paying bills for residents of Frederick City. And so I know that they were reaching out to FCPS for all like the bus drivers who were laid off to see if they needed assistance, or even teachers if they were struggling.
As a municipal government, Frederick has to collaborate with other governments within the county or even within the whole state. Could you provide any examples of that occurring and where such opportunities may be?
So in indicating what some of these funding sources are, the city puts an amount of money out of its budget into our Department of Housing and Human Services. We get an allocation from the county to do that. There's funding that comes to us from the state government. The lion's share of that funding is federal entitlement funding that comes to us because of the way we're identified under federal code. And so that's the bulk of the money, and each of those pots, so to speak, have their own requirements associated with them. There's a big piece of the social services delivery when it comes to government that is about, I mentioned earlier, compliance, making sure that you're complying with the requirements for the different pots of money. And while they might all come from the federal government or from the state, each one of them has their own rules. So one of the things that's a challenge sometimes, I think, in government and in the delivery of services is to make sure that we're remembering why we exist and that we're here to serve people, not that that we're here to check boxes and fill out reports and forms. Those become necessary components of what it is that we do, but we have to do that in furtherance of the larger goal, which is to deliver high-quality services to people in need in the hopes that they will achieve self-sufficiency, that we can break the cycle perhaps or fix the momentary problem that may be leading to a housing or food insecurity issue or an inability to pay a utility bill, a loss of a job, something of that nature, where we can quickly come in, potentially refer them to services, get them connected and get them back on their feet. There are others where the needs are more long-term, and we rely very heavily on that support that we can get from those other level of governments, all being lined up in support of the people at the end of the day that we're trying to provide help to.
And speaking of getting back on our feet, we are currently in the middle of a pandemic, and we would like to know, how has COVID-19 affected the demand of these services, and how has it changed which services are offered currently?
Yeah, I don't know that it's changed which services are offered, but certainly it's changed how they're offered, and the breadth of the need for those services. So something as simple as food distribution, which we used to do largely through our centralized food bank operation, has been decentralized in the city and across the county by different organizations who are doing their own food distribution, but also supporting the city's food distribution efforts through our food bank. Very early on in the pandemic, we understood that the ability to control the spread of COVID-19 within a population that was unhoused or underhoused was going to be critical. So we had to set up a plan very early on to recognize that a congregate living facility like a shelter is not the best environment to keep people safe from COVID-19. So we were going to have to disperse that population to other housing arrangements to make sure that we didn't see some sort of a spike or outbreak within a community that already has challenges, and then layer a public health challenge on top of that and what that would mean. So a lot of the service delivery has continued, but we've had to modify the way in which it's happened. And we'll need to do as the pandemic continues and not really having a clear idea of when we'll be out of it completely. There'll be pieces of this that live with us for months and maybe years, is to really evaluate whether or not we've learned things, positive things, from the way in which we've had to reevaluate during the pandemic that ultimately will make the provision and delivery of these services in the future more effective and more efficient for who we're trying to reach.
As I know, I've talked to certain friends or peers, acquaintances about how it's been a lot harder to find opportunities, obviously, to volunteer and help around the community, especially with the pandemic. I'm sure there are opportunities, plenty of opportunities where you can have safe social distancing, masks on, opportunities that will help the community, as I've seen, as I have done with National Honor Society before.
However long the pandemic goes on for, people are going to be struggling for probably years after. So I think the biggest thing is to continue having the same opportunities, if it's paying people's bills if they are behind, or rent, or whatever they need. I think the best thing is for local governments and nonprofits to continue doing that if they can.
Throughout the pandemic, the people have found the need to give back to their community, and we would like to know, how can Frederick citizens help their own community?
I think that's been one of the really wonderful things about something that has been not wonderful for all of us. This pandemic has taken a terrible toll on our community, both in terms of lives lost, loss of economic power, loss of productivity, of community. But where we've lost community in terms of social events and social engagements in ways that we come to really appreciate here in Frederick, we've gained it in the willingness of people who had the time and the ability to assist others to step up and do that. So there have been people who volunteered to do those food distributions, people who are helping to the greatest extent now to either help people get vaccinated, volunteering to be part of those vaccination clinics. The community really has rallied in support, particularly those people who may not have been as affected economically by this to recognize that they have the ability to assist those who have been terribly hurt by the effects of the pandemic. So we've lost community in some ways, but I think we've built and strengthened it in some ways that are so much more important that long term, I think Frederick will be stronger as a result of what we've all been through together.
Mr. Mayor, thank you so much for your time today. And thank you all for tuning in today for the second episode of Civics with the Mayor on human and health services. We would like to see you back with our next episode next month. Thank you.